So thank you again, everybody who's joining us on the line. Appreciate you being here. No, it's a pretty weird time. So let's learn some things together. For those of you who might not be familiar, this is being put on by the Global Shapers community, specifically the Washington, D.C. hub. If you don't know what that is, it is an initiative of the World Economic Forum, and it's a network of young people under the age of 30 who are working together to address global challenges. So that obviously is this right now. My name's Stephanie Kenner, and I'll be moderating the panel. We have assembled a group of experts from our hub who are all global shapers and are interacting with this crisis in various ways. So I'm going to give a rundown of our very impressive speakers. First up, we have Dr. Eric Feigl-Ding. He is an epidemiologist, nutritionist, and health economist. He is faculty at the Harvard Chan School of Public Health, senior fellow at the Federation of American Scientists, founder and executive director of toxinalert.org, chief health economist and director of epidemiology for Microclinic International, and former founder of the 6 Million Person Campaign for Cancer Prevention. If you would like to know more about him, he has his own Wikipedia page. And among his many accolades right now, he is currently ranked as the second most influential healthcare professional on COVID-19 in the world. So welcome to Eric. Additionally, we also have Clara Tsao. She is a civic tech and national security entrepreneur. She's currently building a new industry organization focused on the trust and safety profession. She is a non-resident fellow at German Marshall Fund's Alliance for Securing Democracy and a 2019 fellow with the Mozilla Foundation, where she worked on content moderation policies and technology tools to counter online disinformation. Clara is also the chair of the board and president of the White House Presidential Innovation Fellows Foundation and a senior advisor at Tech Against Terrorism. Clara has worked across various national security roles in the US government, serving as a senior advisor and chief technology officer focused on emerging technology policy, countering terrorist use of the internet, and foreign influence operations online. And joining her is David Agranovich. He is Facebook's Global Threat Disruption Lead, where he coordinates the identification and disruption of information operations networks across the Facebook family of apps and develops policies to deter misuse of the platform. Before joining Facebook, he served as the Director for Intelligence at the National Security Council in the White House, where he led the United States government efforts to address foreign interference in democratic systems and elections. Next, we have Kim Bryden. She is the CEO of Curate. She has worked in the food and beverage industry, from government Fortune 500 retail management to food tech startup. In 2014, she founded Curate, which is a mission-driven firm with a suite of products and services that connect big and small businesses in the cities they serve. Through Curate, Kim has worked alongside anchor institutions in Baltimore, emerging retail outlets like Glenn's Garden Market, and nationally acclaimed food brands such as Beefsteak, which is a Jose Andres concept. She also has developed and executed small business educational curricula for Apple, the University of the District of Columbia, and the Latino Economic Development Center. She also hosts a weekly podcast called The Tidbit, where she sits down with guest experts to discuss trending new topics on food, business, and culture to help prepare entrepreneurs for their business journeys. She's been recognized with the 2018 Think Local First Ripple Effect Award, received a 2019 Beacon DC grant for her work to promote women-owned businesses, and received a 2020 Innovation Accelerator grant from DMPED to strengthen our local growth stage food and beverage community. And then finally, Peter Williamson. He's a professional golfer turned creative philanthropist who founded a non-digital game agency called Game Genius in 2018. The company focuses on designing custom play experiences to empower individuals and teams in the greater DC region. From tabletop game products to social gatherings, he's passionate about making what you do and care about more fun, and believes that play is critical for the health of our communities. In addition to Game Genius, Peter wears several hats that include leading a local next-gen giving circle, participating on the boards of nonprofit and family foundation, as well as reviewing grant proposals and applications for multiple institutions. So, as you can see, we've assembled quite a panel of experts, and at the high level, what we're going to talk about today is, what does the science say about COVID-19? what has been the impact on our society so far? What can you do personally in your life, and how can we help others, especially in the DC area, but also more broadly? One note about the flow of things, as we're going through, you'll all stay muted. However, if you want to address any questions to our panel, you can go ahead and type them into the chat function as we're going through, and we'll collate those, look at emerging themes, and try to answer some of them at the end. So once again, thanks for coming along. And first, we're going to turn to Eric. And Eric, what's going on?
Oh, I think not much, other than a pandemic.
Yeah.
But a pandemic that we should have known about and seen coming for a long time. And I was shouting at the top of my lung in January before the WHO declared the public health emergency of international concern. And, you know, a lot of people said I was scaremongering, but I was really concerned because there was so much data coming out from China and a lot of anecdotal reports that this was not normal. This epidemic is not your typical flu outbreak at all. And just so people have some background, this is much more infectious than the flu. And for anyone to say it's just the flu right now, it is beyond woefully irresponsible to the level of misinformation now, if they still say that. Because in terms of reproductive number, which is for every infected person, how many additional infected person it infects, this has an R0 reproductive number of between 2 and 4, and perhaps even higher. Like for example, on the Diamond Princess, they calculated early on, it was between 6 and 10. And for context, the common seasonal every year flu has a reproductive value of 1.3. So this is at least 2 times, if not 3 times more infectious. And in addition, it has asymptomatic transmission, so it actually you can transmit it without any symptoms. This was argued about for the first month and a half, and it was finally accepted about 2-3 weeks ago. But again, the early birds, we've been shouting about, this has been a serious issue for a while. So this epidemic, you know, obviously started from Wuhan, but since then, you know, it has a little bit of difference in every country in which it went to. For example, Hong Kong and Singapore, relatively contained, occasionally have a cruise ship, terrible tragedy. South Korea, they had one mega church, but South Korea testing is off the charts. And because of that, they paid dividends, and South Korea is basically leveling off. But in contrast, in Iran, it is so bad that some people are predicting 1 to 3 million deaths in Iran. And, you know, like I think 15% of their parliament or higher is already infected. I always use that as a kind of like the canary in the coal mine. If members of parliament or Congress are infected, you know it's everywhere. And similarly with celebrities. And now obviously Italy is being hit hard. In Lombardy, Italy right now, about 20% of healthcare workers are basically infected or quarantined out of commission. And this is a serious, serious concern because, you know, everyone talks about flattening the curve, right? Because, you know, a hospital cannot handle 1,000 cases all of a sudden in 1 week, but they can handle 1,000 cases over 2 or 3 months. But so the key is to slow it down below the hospital capacity, health of the system. But the problem is, if we're putting doctors and nurses out of commission, this capacity line starts dropping. And secondly, mortality, people always, how deadly is it? Well, there's no biological constant number. It varies between 1 to 3% on average, but Lombardy, Italy, the province where the epicenter is it is about 8%. And it's 8% because they have exceeded the healthcare system capacity. They're out of beds, they're out of ventilators, and when you're out of ventilators, cases that you could have saved with the ventilator, they die. And that's part of the seriousness of the problem of we've looked at the trends. Many other countries will actually have it much worse than Italy, because Lombardy, Italy, by the way, in the OECD rankings, has a 9.9 out of 10 in healthcare quality. There's a top 5% of all regions in the OECD database. The US, meanwhile, is almost always below the 50th percentile. And places like Mississippi, West Virginia, Alabama, we're in the single-digit percentiles compared to the rest of the world. So if and when, it's a when, the virus really hits all 50 states with a really hot epidemic, it's going to be really bad. So in terms of time-wise, Western Europe is just 5 days or so behind where Italy was last week when it started getting bad. And the US probably about 3 or 4 weeks, maybe sooner, depending on the containment.
So based on, I think a lot of us have been reading the stories out of Italy, and it's obviously really chilling, in the triage sort of guidelines that have gone out. Do you, based on what we're seeing in the U.S. response, do you see, like, are we headed towards an Italy situation, or worse or better?
Yeah, I think we are, because we have way less healthcare capacity in terms of hospital beds. We have more ICU beds, but we have much fewer hospital beds. And also our testing is way behind Italy as well as South Korea. South Korea, by the way, tests 3,600 samples per million people. US last week tested 23 per million. And so that disparity is just enormous. So we could already have been caught up with Italy. We just don't know it yet. But in terms of epidemic, obviously we're 5.5 times bigger country than Italy in population. But looking at New York, it's not even in the US. New York right now has a really bad epidemic. So does California and Seattle. The capacity to deal with them is really, really limited. And without enough testing, right now there's shortages of reagents, as well as shortages of swabbing kits, by the way. That's not been talked about enough to actually collect them. Like LabCorp and Quest can do massive testing. They actually have the capacity. They have the reagents, they have the test kits. Their problem is they don't have the to collect them, and most clinics are out of them. So these huge problems, and now obviously the lack of PPEs is really going to hamper, because if we lose a huge number of our healthcare workforce, that's going to be abysmal.
Yeah. So clearly, going to your earlier statements, there's a lot we should have been doing that we haven't. So there's nothing we can do, unfortunately, about that. Yeah. So what, at the systemic level, what needs to be happening now that isn't happening, or like what do we need to ramp up that would make a difference and flatten the curve, as you said?
These social distancing, obviously almost all of us are working from home now. But the thing is, these states, their 50 states are all very different in terms of containment. Some have closed schools. Some say they'll close for 2 weeks. Some say, California says we're probably going to close until the rest of the year. In some places, they're closing bars and restaurants. Some places they're not. Other businesses can stay open. There's capacity limits. For example, some places are 250 or higher bans. Some places bans 100, over 100. Some bans anything over 10 gatherings, which includes canceling people's weddings too. It's and big conferences. What our containment is not nearly even close to what China did. Because China, obviously, they closed down Wuhan, but it also imposed residential lockdowns, as in you cannot leave your house unless you are having some emergency, and they bring food to you. Contrasted with Italy has a shelter in place, but Italy, you can still go to grocery stores. And lo and behold, where do you have big congregations of mass people these days? At grocery stores. So we're not even getting close to what China can do. They have massive supply of ventilators. They moved tens of thousands, like 50,000 doctors and nurses from other provinces in. We can't clear out New England doctors and put them in Seattle. That's not feasible for us. And mass producing a lot of massive ventilators is just not feasible. The US is in serious, serious trouble. And the numbers that are coming out is really bad because unlike South Korea, where they're testing on the frontier, the front lines. Like whenever someone gets sick, have a fever, they get tested immediately, isolated immediately. But in US, we're not testing the frontier of new cases. We're testing basically a backlog of cases. People who've been sick for 10 days. An LAPD police officer was tested sick, but he didn't get his result for 10 days. That is basically everything that's happening. Either they're not getting tested, or if they're getting tested, we're testing old cases, which means we're not stopping we're not doing the containment. And if it's going to peak, everyone keeps asking, is it going to end? Will it end next month? No, it's not going to peak until at least May. And that depends on our containment measures. This thing will be with us. It might go down in the summer. I will agree that, but it'll definitely resurge back in the fall. This will be with us until at least February 2021, when hopefully the vaccine arrives.
Wow. Okay. So we're going to move it on, but I do have one final question for you. So I've heard a couple of news stories about people being reinfected after healing, but so what is that legit? What's going on there?
Right. It's possible, but most likely it's not reinfection. It is that the test was a false negative. And the test is not that reliable so far. Not because the chemistry is bad, but because the virus properties, you have different fluctuating viral loads. And some days your viral load drops a little, but then it goes up. So the Diamond Princess, the passengers, Americans were being repatriated. There was a big blow up because the CDC didn't want them on the plane. What happens is they tested negative, and then just as they were boarding the plane, they tested positive. And it's not that they suddenly got infected or reinfected or something like that. It's the test is not sensitive enough to varying viral loads. And this is a serious problem. So we're, in addition to being tested, we're also missing a lot of cases because of this fluctuating viral load thing. This is altogether creates a perfect storm. Low mortality in some ways, high for older, but long asymptomatic transmission, a test that's really bad, virus shedding that lasts up to 37 days. And this is the kind of virus that basically will conquer the world. And here we are.
Okay, well, on that super cheerful note, I'm gonna turn us a slightly different direction now to Clara and David. I'm gonna have you kind of together, tag team if you want. So you guys have been working on like disinformation that's happening. I think that, obviously in our hyper-connected world, a lot of people are sharing things out of ignorance, but a lot of people are also sharing things maliciously. So if you guys go ahead and start us off by telling us what you're seeing.
Yeah, so I think it might be helpful to just take a step back and talk about online disinformation more broadly.
Great.
It's always been in major crisis moments that most platforms today have taken strong action. A while ago, whether it was around child exploitation online and legislation that mandated that companies get fined for having child pornography. And then there was terrorist content online where a lot of companies are trying to deal with some nebulous criteria around what is a terrorist organization and what is not, and what are our policies to really decide whether we should take down content. And now the hot topic of today really is around health disinformation, right? There's a lot of things that people are spreading that actually at some point can be incredibly harmful. We've seen this actually in a pattern around the anti-vax movement, where there's swarms of communities of people that really do not believe in vaccines, and they spread this. And the internet today is a melting pot where if you are looking for something to have and share your worldview, you will be able to find content that actually supports that. So the way that one of my colleagues, Camille Francois, one thing that she likes to define it as is the ABCs of disinformation. It's a little bit more difficult, broken down than just this is good and this is bad and should be removed. So when you're thinking about online disinformation and misinformation, the ABCs are A, attribution. So who are the actual actors behind a campaign? And it could be a foreign country like Russia trying to push a particular worldview on a population. It could be someone that is trying to make money and monetize, right? So that actor piece is so important. B stands for behavior. So there might be deceptive behavior that certain actors are doing that is not transparent. This could be people that are specifically spamming bots, as an example, just swarming, having large swarms of bots push particular types of content. And the third is C stands for content, harmful content. And so a lot of what we see in health disinformation today comes from misleading content. So when you break it down of how misinformation and disinformation actually happens, it's really important to understand these basic ABCs. I think, in terms of talking with David, maybe we can just go back and forth. So David, do you want to jump in from your side?
Sure, yeah, and thank you for level setting that, Clara. At Facebook specifically, we look at content when it comes to misinformation, so people who are sharing information that is false, but without necessarily knowing that it's false. We don't look at content when it comes to disinformation, and we differentiate between those two things because it's important in the disinformation world that most of the information being shared is not provably false. So my team focuses on investigating these types of coordinated disinformation campaigns around the world. We've taken down, I think, over 50 of them in the last year, including a couple Russian attempts to target the 2020 elections. In the coronavirus space, we have seen fewer coordinated state-backed disinformation campaigns on the platform, and much more of the independently shared misinformation around health information, stuff that your neighbor or your friend or a friend on Facebook might share about some coronavirus cure that isn't actually true.
Like drinking water.
Yes. Like drinking water, exactly. Where we have seen state actors involved is in what I would call the white propaganda space. That's the official mouthpieces of nation state governments sharing information meant to manipulate or mislead. An example of that would be every couple of days now, the Chinese government foreign ministry goes on television or Chinese state media, shares information about, questioning the origin of COVID-19 or claiming that it came from a US military base or from a US biological weapons lab. We've seen similar efforts to amplify, questioning the origin of the virus from Iranian state media. Press TV just this morning ran an article saying that the CIA created the virus. It's interesting as well, a couple of governments have made pronouncements about disinformation campaigns they're seeing across the internet. As of now, none of those governments have shared any clear evidence that those campaigns are actually happening. There's a report from the US State Department. Around the same time the US government was claiming that COVID-19 wasn't that big of a deal, there was a report stating that the hysteria online was a Russian disinformation operation. And the European External Action Service, which is Europe's equivalent of like a foreign ministry plus CIA, had a report leaked yesterday claiming that Russia, China, and Iran were also stoking fears over coronavirus. Unfortunately, at this point, most of the platforms just aren't seeing that type of behavior. Where there is coordination, it's, as Clara mentioned, financially motivated actors. So people trying to make money by driving people's attention off to websites where they can monetize through ads or sell medical supplies.
Yeah, so beyond what Facebook has been doing, and I'm sure, not to call you out on this, David, maybe we can talk about people who do the work. There's a lot of people at companies that work on trust and safety teams that determine what is acceptable content and behavior on platforms. And there's a lot of people that are outsourced at larger companies to third-party vendors that actually do the actual manual work of deciding what is acceptable and what's not. And so one big challenge that has happened actually with coronavirus is a lot of these vendors are actually not able to go in person to work, and they have all been put on paid leave. So the work has now transitioned in a lot of large companies to the hands of full-time employees that now take on this burden. And there's a lot of reasons why this decision was made. In one interview that Mark Zuckerberg actually did 2 days ago, he described it as a big challenge because a lot of at-scale content moderators, they do not have the mental health support when they're looking at extremely violent and graphic content. And on top of a lot of financial and other challenges they're already dealing with, especially in social isolation, this becomes even harder for a lot of people to have to do manually at home. So that is a challenge that a lot of large companies are focusing on. In terms of an actual action against all types of bad behavior on platforms, there's really three approaches that most companies have done. First is a lot of companies have tools used for detection. This could be, analysts that really have a good sphere of where content might be living and ways to detect content. There are obviously a lot of marketing tools you can use to look at what's trending up and what could go sideways. The second is around enforcement. So this comes in terms of the policies that a company might write up. It could be a brand new policy that states we're going to stop, and Etsy actually did this, we're going to stop selling, have merchants sell shirts to monetize on content like straight from Wuhan. So there was a couple of t-shirts that sellers were selling around coronavirus to really monetize on this. And some of them were considered incredibly racist. And then the third is around what can we do to actually educate when there's a disinformation campaign out there. To what point should companies actually take a stance and try to correct something if it goes out of spiral, right? And so a lot of companies around coronavirus, they've actually ended up redirecting to educational resources like the CDC to make sure that users are not looking at misleading news or false articles. So those are a couple of places, but I would love to hear from you, David, a lot around the content moderation space. A lot of companies today have also decided to use automated tools, leveraging AI and machine learning to do quick detection, because obviously there's a lot of content that's relayed every single day.
Yeah, it's actually really fascinating what this is doing to moderation of conversations on social platforms. Every company has taken a slightly different approach, both a different approach in how much to use automation and a different approach in where the thresholds for automation should be. I know Eric and I last night were just talking about Spampocalypse, which was 2 days ago, a Facebook spam system unrelated to the coronavirus mobilization went haywire, wrong thresholds when we did a software update and started removing everybody's posts for spam violations. And everyone immediately assumed it was because we were trying to take down coronavirus content. What's happened is essentially, yeah, and that was the broad assumption. And frankly, it's fascinating. Unfortunately, like, these things happen at the worst time, but it had nothing to do with the coronavirus move. But it exemplifies the challenge that many of these larger platform companies are dealing with, which is without human moderators, which is essentially where we are now, right? So content moderation, especially our contingent workforce, are all at home for a variety of reasons, both mental health support and workplace safety, but also privacy protection requirements in the United States. We can't have people do content moderation from home. And so many of these companies have had to lean much more heavily on automated detection systems. Frankly, there's a lot of hay made about the advancements in artificial intelligence. In reality, the AI systems are only so good at identifying and removing bad content. What that means is that each company is deciding how much error rate they're comfortable accepting and what the negative downside effects of leaving up potentially violating content would be, or taking down things like, for example, someone's post about coronavirus awareness in their community. Facebook put out a blog post yesterday kind of laying out how we're going to do this. It's pretty explicit about the fact that we will pretty much be prioritizing content review by human, full-time employees around child safety, terrorism, suicide, self-injury, and harmful content around COVID-19. But that frankly, people will have to accept that there will be a higher error rate on other types of content enforcement. Other companies are taking different approaches. YouTube notified their creators that they should expect to be over-enforced against, and that there won't be much of an opportunity for appeal for the period of time where they don't have content moderators available. So it's an interesting time of companies going to full automation well before I'd say those systems are advanced enough to do this on their own.
Yeah. Thanks. So we're gonna turn it over to Kim, but before we do that, any final thoughts on this? Fascinating. Okay, sweet. So we're gonna turn it over to Kim, again, kind of shifting lenses. Obviously, the effect of this virus has, you know, touched every facet of our lives. So Kim, if you could tell us a little bit about what we're seeing as far as the effect on small businesses.
Absolutely. And my focus is in the food and beverage industry, but I can talk about product and service-based small businesses at large as well. I think a lot of things people are listening to right now have to do primarily with the restaurant industry and the amount of layoffs that are happening for any sort of service provider because we cannot congregate in large spaces. In DC, in New York, obviously that is now banned. And what I'm fearful of is, at least in DC, taking after what's now happened in New York, is that perhaps these businesses won't even be able to do carry out in the near future. And so what does that mean for these shuttered businesses? A Wall Street Journal reporter just wrote that Goldman Sachs warns data points from unemployment insurance claims, currently 281,000, will surge to 2,250,000 by next week. It's pretty remarkable. Yeah. And so that's one piece of the food supply chain, of course, the final direct to consumer to our mouths. And of course, it's something to really be cognizant of and think about. But I also want us to talk about and hopefully share and ask questions around the entire food supply chain. I think we are now becoming more aware of how many literal hands touch our products in a globally optimized world, and what happens when a point of failure occurs in that efficient global supply chain. And so what I've always done for the past 6 years of running my business, I have been shouting from the rooftops the need for a localized supply chain in moments like these, because if it is not for a moment like coronavirus, we should be cognizant of how we're spending our money and with whom, because we need to be able to see our community and our neighbors who are these small business owners as vital parts to our lives. And how are we making sure that money is funneled to them in an ongoing, consistent basis so they can survive and thrive moments like these? So as you mentioned in my intro, thanks for that. I have a radio show called The Tidbit, and oftentimes we discuss this. What are these new economic models, these new ways of thinking about how each of us is an investor with our dollar every single day, and who are we supporting? And I think that is becoming so obvious right now. This is actually my moment of hope in this conversation, is that I am feeling inspired and optimistic and very tender in this moment of seeing how many people are voting with their dollars and saying, I want to support this type of community small-based business, and I am going to be purchasing XYZ good from them, ranging from local grocer and corner store through to an actual product itself. And I hope that as this passes through our society and we have the opportunity to rebuild a new economic order, that we are all conscious and making sure that this resiliency in our local supply chain can still occur. So I just wanted to say that broadly. A New York Times article recently titled, "Food, a Basic Pleasure, is Suddenly Fraught," said this, I'll just read a little snippet. It says, "Meal times arrive 3 times a day. How do you feed yourself and your family when restaurants are shuttered and store shelves are emptying? And how do you take care of a community in crisis when caregiving meals like Sabbath suppers, pancake breakfasts, casseroles for new parents, and funeral foods are off limits?" And so not only are we thinking about the economic downturn and what that means for small businesses, but also looking to each of us and how food is such a space of connectivity. And what that does to our emotional state. I think so many people have gotten so used to delivery to their door, this one click, obviously, Amazon, don't even get me started, optimization of our lives, and what happens again when those channels start to become more and more disconnected, or people don't want to engage in that way. So we're turning back to cooking. And when it means to cook, how are people then sharing that? Do people feel pressure online because they're maybe not cooking to the same degree or like Instagram cachet that other people are cooking? And so there's just this weird time right now where there's like this emotional contagion about this as well. And sort of like what happens to our social status when you're seeing what people are eating or not eating, and what they're cooking or not cooking. And what does that mean for our own social pressures around how we're looking to connect? There are these two psychologists out of University of Washington that talk about building relationships and how we as humans each day are making little bids towards one another. Like, oh, maybe, oops, sorry about that. Maybe you are, maybe you love birds and I don't really care about birds. And you're like, oh, see, look at that bird. It's so beautiful. I could either keep doing what I'm doing and be like, yeah, cool. Or I could turn towards you and be like, yeah, that bird is cool. And so I see, this is a weird analogy, but I see
it's like that Black Mirror episode of like social, content. Yep.
Yeah, but it's a lot of us using food via digital channels to make these bids and say like, let's connect, let's turn towards each other. But then there's also the flip side of what happens when this goes on for many, many months and we start seeing these stops in our supply chain, the inability for people to access food in a routine way. And how do we make sure, I'm just preemptively talking about like, how do we make sure that we're not using our online connectivity to create more inequalities and depression, because food is such a great equalizer. And then on the business side, for now, because there is still delivery and takeout, you can imagine from large volume caterers to your local one-off restaurant, everyone is now direct to consumer. Everyone's in delivery. It is so saturated. It is a wildly saturated sales channel right now, and it is extremely hard to cut through the noise because there's no there's no other way for you to attain revenue. And so people are seeing more or less, I've seen on average, people are making 10%, if not less, unless they've shut their doors, 10% of their normal gross sales volume. So it's very scary. But again, to add some optimism, I've also seen some incredible innovations in supply chains. So many distillers, for example, are now making hand sanitizer, which I think is a really beautiful innovation. And I think, again, going back to the point I made around localizing our supply chain, that is where I see the true beauty in this, is saying, what is the supply that's needed and what is the demand, and really making that on a city by city, community by community basis, because we are very creative and adaptive as humans. And I think by having more transparency between that supply and demand matching will only prove really beneficial for all of us. I'm going to share a Google document that I have with a bunch of links for loans and grants for small business owners, tax information for small business owners, state announcements, DC, Maryland, Virginia, and Pennsylvania as it pertains to business and also the food industry and food resources that you all can share with whomever you find appropriate. But the last thing I'll just share quickly, in this same New York Times article, they wrote, it's almost as if our victory gardens, which were a part of World War II, it's almost as if our victory gardens are how we are using our digital expertise to feed ourselves and help others. And I recently read this book by Steve Case called The Third Wave of the Internet. And essentially, he's saying that the first wave of the internet was what he was a part of, making America online. The second wave was then everyone coming online, Facebooks, Googles, and whatnot. So technology is ever present. And the third wave of the internet is how are we using technology to perhaps improve transparency and efficiencies of outdated systems. And I myself and at Cureate, I've always felt like we've been a part of this third wave. And I can't imagine a more stark moment in time to really emphasize how tech has the capability to really, again, democratize access to opportunity and provide that transparency we're all craving. And especially when thinking about our food supply chain, of course, I want you to think about your restaurant workers, but also think about the farmers and every single piece of that entire kit of parts that makes up that food coming to your mouth. And if you are opting for a channel of delivery, consider supporting your small local business and not just doing an easy one-click solution from Amazon, because it is, and people are in dire straits right now. So yeah, I'm open and welcome to anything anyone has to say about my spiel.
So Kim, we're gonna move over to Peter in a second, but the link that you're gonna share, which thank you, I think that'll be really interesting and helpful. Does it have any like easy suggestions for ways to, or resources for people to do that, to choose, you know, maybe not Amazon or Uber Eats or that sort of thing, to, you know, to think more locally?
Yeah, there are resources being developed now. I'm a part of the Mid-Atlantic Emergency Feeding Team, and we're right now coalescing essentially. I myself am doing a local supply chain audit of all of our vendors. We have a community of over 400 producers. So that could range anything from bagels to ice cream to beef jerky products. They're a part of the food supply chain. So there are other people who are focused on restaurants and, again, that final direct consumer channel. I work more in that product space, and then other people work on farmers. So we actually have a call in an hour to talk about how to aggregate all pieces of that into one centralized data source.
Cool, great. Yeah, that sounds like quite the undertaking.
But I mean, it shows us how important it is for us to mobilize and how quickly we like, it's all there, which is pretty cool, you know, like it's there. It's just now we need this fire lit under our butts to mobilize and take action.
Mm-hmm. Yeah. Okay, so thank you so much for that. And Peter, I'm going to turn to you. As long as you're not being a selfish spring breaker, for a lot of us, you know, our lives are dramatically different right now. And so just going to turn it over to you to talk about some suggestions for mental health, for gamification, essentially, of our lives while this is going on.
Yeah, no, thank you. This has been very, very interesting, and hopefully I can give a few action steps and light into the scenario. Kim, this is a perfect setup as thinking about ways to utilize what we do have to be able to help yourself, sort of your relationships, sort of close relationships, and then your community as a whole. As Stephanie shared in the introduction, I was a professional golfer, and so I've obviously had the luxury of being in a space where there is a lot of play happening every day. And I was able to travel around the world and see a lot of different cultures and how they play differently and what that does to affect sort of the greater community writ large. And then also being sort of from an architecture design perspective, thinking about how, as Clara mentioned, sort of the ABCs, I like to think about sort of the DEF of the equation, which I define as disruption, effectiveness, and focus. And I can kind of get into that and how it fills out what a lot of the Shaper community is all about, kind of the dialogue, action, change framework. And so what I love to have people think about is what their favorite game is. What do you like to do in your free time? What makes that game special is generally the dynamics between players. So thinking about it in the ABC, sort of who are the players, what are their attributes, sort of what are their behaviors in that game, and then what is the content and story around that game? Why do you like it? What brings you sort of that joy, the artistic quality? Is it the quality of the experience? And then thinking about sort of that in the context of a game, how can you foresee the challenges that are going to come to you as a player with certain attributes? how are you going to take what your attributes are and turn them into effective solutions for kind of yourself, your relationships, and your community, and then really focus on what you can do and not worry about what you can't. Because I think in times like this, it's very much going to be all about kind of your efficient focus. And as Kim mentioned, local is a really, really successful model for philanthropy, for playing a game, getting it together and playing with people, because you're building those relationships real time. And so I can go a lot of different directions with this, but figured I'd sort of start with a couple things that I've seen that have helped a lot of people. One is thinking about kind of collaborative games and how that can help you sort of both cope, but also enjoy the process of building communication and trust in communities. We've learned a lot about disinformation campaigns and different things that are affecting us today. And games can be a nice step back and simulation of how you can try to test and iterate some things along your own course. Other things that I've seen have been about trying to make relationships between how urban planning can relate to game design. So thinking about all of, again, the factors that I had just mentioned, how everything comes together in a really coherent story can help you make sense of where you fit into that puzzle. One of the things that I'm doing personally to try to help, I run a non-digital game agency. So you can imagine that's not an ideal time for me right now. Mm-hmm. But being a game designer, have always thought about different resilient strategies that I can have in place in case we have moments where I can't be in person with someone, which I think is incredibly important. But there are ways to turn your favorite game digital. And so we're doing a lot of virtual game nights with organizations to try to help them spread their mission, but in sort of a clever, fun way. There are a lot of games, surprisingly, that you can convert to an online platform. Whether it be kind of communication games, if you've ever played a Taboo or a Heads Up, you can always play those online. But different ways to practice that communication, I think, is critical, especially now, because we're not having as much face-to-face contact. And I cannot stress enough the importance of play in sort of the culture that we live in. It's so important to the way we grow and learn. It's not an intuitive solution to something like this when everyone is really stressed and thinking about kind of their core needs. But play is something that can kind of work as a tool to fill a lot of gaps and to help you grow to a solution or a goal that you're working towards, or at least define a goal. Sometimes it's just making sense of where you are. And so that's sort of where I start. Other hats that I wear are in philanthropy, and helping local. So Kim kind of touched on a lot of those points already, and thinking about ways to really support your local community. One of the key drivers for part of a family foundation, thinking about how you can engage everyone and make it as accessible as possible. One of the things that I've helped do is launch a giving circle here in the DC region. And one of the core functions of it is that we want as many people to join it as possible, because it's an amazing learning experience to be able to give, but also see other people and how they give. It gives you a good perspective of the different ways that you can do that. And what we're finding is that the more local you give, the more you can celebrate the success with that community. Nothing against sending money overseas or to communities that that could use it and super vulnerable, but for your sort of sustainable and mental health capacity, that local support is something that we've seen be a lot more effective kind of in the short and long term.
Yeah, and I think one thing that's really important, the outpouring of good intentions and people wanting to help one another has been really, really beautiful. But I do think that we always have to be, thinking about how we help very critically. And I think, plugging in this hyper local way is one way to combat this sort of tendency of like white saviorism, to just, throw some dollars, like swoop in and then and then swoop out again. And in this case, when you're actually like living in, working in community with other people, that at least helps, you know, heading off that sort of tendency when you're wanting to be of help.
Absolutely. Yeah.
Okay, so I'm this time flew by. Everybody has been so fascinating. We have 3 minutes left. So we had a couple of really good questions. So I want us to be able to have an opportunity to answer that really quickly. And all of them are for you, Eric. So are you? Oh,
I'm here.
Hey, cool. So just a couple of quick questions that I selfishly want you to answer because I'm curious myself. So going back to your timeline of saying that, you know, we're not anticipating necessarily like a vaccine until February 2021. Are you anticipating that this sort of extreme social distancing and closing down, like this new way of life, will have to extend until that time, or will we kind of get back to a slightly more normal?
So my good news is we will have in which we will kind of like pull back from the extreme. The bad news is when we do that, take our pump the brakes on certain things, the virus will come back. It's like, think of a wildfire. You can't put out wildfire by, you know, just airdropping water dumps. It will slow it down to many degrees, but you can't put out the fire. Like the fire will keep going at the very bottom. You can't stop the small patches of fire from these airdrop big movements. What you need to do is do testing and containment at the same time. But right now you can't do contact tracing with 1,000 cases right now. You have to slow it down. And so we're gonna go into this little cyclical up and down. And hopefully when we're low enough, we can try to sniff it out, put it out. But that'll take a huge amount of effort, and I don't think we will have that. So we need basically potentially, if we get drugs early in the next 4, 5, 6 months, that will help slow down a lot of things. But we can't put it out with just these mitigation. We call these mitigation stay-at-home kind of things. So hopefully we'll get better in the summer, but we're in for a long haul. Our life will not be the same for the rest of this year.
Okay. We have to be prepared for that. And then finally, you answered some of these questions already, but for people, because of, you know, the testing challenges that you mentioned, if I think I've got some symptoms, when should I go to the hospital or go to a doctor's? I don't want to overburden the system, you know, as you were saying.
You should first of all be using telemedicine. We're like increasing telemedicine a lot more, because if you go to a hospital, you're coughing in the ER and to other patients, it's actually kind of dangerous. The best way is I think hopefully we'll have dry testing more available. And hopefully you can eventually get testing without a doctor's note. But it would be those kind of things. Hopefully there's a separate clinic or shelter that can do that instead of going to your ER doctor. And hopefully we'll have enough swabs and all the chemicals, reagents. So right now, my motto is test virus now. I would insert a few expletives in between, but yeah, that's how I feel about the situation.
Fantastic. Okay, thank you for that. So we've reached the end of our time. I do want to go like a minute over. I'm giving short shrift to our 10-point plan because it's the only part of this that we actually have laid out and written somewhere else. I'll include a link to it in the chat, but as shapers, we've developed a list of suggestions for what you can do personally, things even just as simple as, you know, the washing your hands to expanding your aid to your community. So as Peter and I were talking about there at the end. So please feel free to check that out. If you're not from the DC area, please take it and adapt it to your location, your situation. It's meant for wide dissemination to try and give people the opportunity to step in, because if there's anything this has shown is that we need to help each other, and that we all have different things to offer. And on that note, I just wanted to to give a quick definition of mutual aid from Big Door Brigade, because I think it's a really useful kind of grounding of our intentions and philosophies going forward. So mutual aid is a term to describe people giving each other needed material support, trying to resist the control dynamics, hierarchies, and system-affirming oppressive arrangements of charity. Mutual aid products are a form of political participation in which people take responsibility for caring for one another, not just through symbolic acts, but by actually building new social relations that are more survivable in the long term. So we've heard a lot of dire things today, but also a lot of things about how we can hopefully seize this moment to really see some social changes that we want to in the long term, and hopefully the solutions that we build right now will outlast the crisis. So thank you all so much for joining us. Thank you so much to my panelists. That was fascinating. I wish we could talk to all of you for hours, but I'll let you go.
Thank you.